Hi, my name is Maria Frias, and I am doing my assessment for RN52 leadership. I'm going to go over how to do an assessment, a thorough assessment, and a focused assessment on a patient who's going to have abdominal pain. First, I want to have with me to do vital signs. I would have an oximeter, an otoscope, a pen light, thermometer, a blood pressure cuff, and a stethoscope. And the stethoscope, I would also listen to their lungs and their heart and their bowel sounds. So I would assess their temperature. I would assess their orientation times 4, their heart rate, the respiration rate. I would confirm prior to doing any assessment on the patient. I would confirm the patient has 2 identifiers. That could be having them confirm their name and their date of birth. I would do a safety check, get hand sanitizer, give the patient privacy. I would then proceed to ask them the reason for their visit. And then if they're having abdominal pain, I would want to know when the symptoms started, how long have they had the symptoms, and describe the characteristics of their symptoms. And then I would do an assessment of starting with their head, check the distribution of their hairline, make sure there's no infestations, any bumps, nits, lesions, palpate the scalp for any tenderness, check for facial movements, and assess for sharp or any dull sensation on the face. For the eyes, you would assess the symmetry of their eyes, their eyebrows, their lash distribution, check the status of their conjunctiva, check the sclera, and then assess the patient's cornea. And then we will assess for the pupils, their pupils are equally round, reactive to light. And then you'll do the 6 cardinal position change to see that they have all their nerves intact. So you go to the middle, up, down, to the top corner, to the opposite, then you go to the other side, and then down. And then we could do an eye exam, a visual acuity. We then go to inspect the ears, check around the earlobes, make sure there's no lesions, any sores, tenderness, and then we'll assess inside the ear to make sure there's no drainage, no discharge, or if there's any serum impaction in there. And then I would use an otoscope to look inside the ear, make sure everything's normal. And then I would assess the patient's hearing, doing a whisper test. So I would close one ear, and then on the side that's not covered, I would whisper 3 words and see if they can hear it, and then I would repeat it to the other side. Next, we would check the nose, the same check for symmetry, and then we'll inspect inside the nose, and we would use the otoscope because you can go look inside to make sure that the nostrils are even and there is no septum deviation or any polyps or any obstructions in the ears, in the noses. and you want to verify that they're able to breathe through their nose, and test their sense of smell. So I would use either like a mint without the patient knowing what I'm having them smell, or cinnamon, and then they'll let me know what it is. And then you palpate the sinuses, make sure that there's no tenderness or any pain. For the mouth and throat, assess the inside of the mouth, make sure there's no sores, cuts, and the teeth are all, if they're wearing dentures, make sure there's no sores in the mouth, take the dentures out, and then make sure there's no problems inside the mouth. Assess the mucosa, the buccal mucosa, and the palates, make sure that they're all intact. Visualize the uvula, and then you'll palpate the jaw joint, and it's the same as their temporal joint. And then you'll assess the tonsils, make sure that they're not inflamed or any abnormalities. And the neck and the shoulders, you want to check for range of motion. You can shrug for resistance, make sure that their nerve is intact. Palpate their lymph nodes, make sure there's no abnormal lymph nodes. And then you'll check for jugular vein distension, make sure there's, lay them down, make sure there's no distension when they're down. Then we'll move to the lungs. You listen to the lungs in the front and the back. Using the stethoscope, you have to take deep breaths in and out. You assess all the way down the front and in the back, and make sure that there's no abnormal sounds like wheezing or rails or crackles, rhonchi. And then while you're assessing the thorax, you'll check for spinal curvature, and then ask if they're having any cough or any respiratory issues. For the circulatory system, you palpate their carotid arteries and the temporal arteries. Listen to the heartbeat. Make sure that they're regular rate and in rhythm, and there's no bruit. And then when you listen to the heart, you're going to listen to the 5 points, which is the aortic valve, which is the first one. And then you're going to listen to the pulmonic valve, the Erb's point, the tricuspid valve, and the mitral valve area. Make sure that that all the sounds are normal, no abnormal audibles are noted. Then we're going to inspect the GI system, and this patient is coming in complaining of abdominal pain, so we are going to first inspect the abdomen, make sure there's no abnormal like lumps or bruising, and then after you inspect it, you're going to listen to the 4 quadrants of the abdomen to listen to the bowel sounds, because he's having abdominal pain and he hasn't had a bowel movement in 3 days. He's more than likely constipated, so his bowel sounds would be diminished. And then you'll palpate the 4 quadrants to assess for pain and tenderness. Next, we're going to go to the arms and hands. We're going to check the range of motion and the strength of the hands. So you have them squeeze your fingers, put resistance to your hands, check for capillary refill on the nails, check for skin trigger, make sure that they're hydrated. If it's tenting, that means that they could be dehydrated. Check for bilateral extremity reflexes, make sure that all the reflexes are normal. And then we'll go to their legs and feet, assess the range of motion, the strength in the legs and their ankles. So you would hit the bottom of the Achilles tendon, make sure that they got the reflexes. The same with the knee, just right below the patella, make sure that the reflexes are intact. And then you'll do a capillary refill of the toenails. They should be less than 2 seconds. Check for pulses. So you're going to check the inguinal, the femoral pulses on both sides. Make sure that they're normal and regular. And same on both sides. Then you will check for the popliteal, which is right behind the knee, to make sure the pulses are present in both. You're going to check your tibial pulses, make sure that they're equal on both sides. The dorsal pedal pulses, make sure that they're present in both sides and they're equal. And then you'll have the patient walk to assess their gait. Make sure that they're balanced and they're not losing their balance when they go back and forth. And so for this patient, when we're assessing the one for abdominal pain, I would anticipate the doctor would order an abdominal x-ray to see if he is constipated and how backed up he is. And then I would anticipate administering stool softeners to aid in defecation. The nursing diagnosis for this specific patient would be dysfunctional gastrointestinal motility related to decreased perfusion. As evidence-based, last bowel movement was 3 days ago. 2 specific patient educations I would give to provide the patient is to increase their fluid intake, drink at least 8 glasses of water a day, increase their fiber intake, and maintain an activity level. And then encourage the patient to have routine, scheduled defecation so they can get used to having bowel movements again. And then finally, the follow-up instructions I would give to the patient would be to avoid long-term laxatives and to maintain an adequate fluid intake and fiber intake. Maintain an exercise routine to keep active and have a good bowel program. If they continue to have trouble defecating, to let their healthcare provider know before they do anything at home.